Hey future nurses, it's Nurse Miriam here. Pharmacology, it's basically a nursing student's worst nightmare, right? All those drug names, mechanisms, side effects, it's enough to make your head spin. But guess what? It doesn't have to be a horror show. In this video, we're going to break down 10 VIP medications you absolutely need to know to rock that NCLEX. So grab your stethoscopes and let's get this medication party started. First up, we've got metoprolol, our trusty beta blocker. It's used for hypertension, angina, heart failure, and atrial fibrillation. Metoprolol blocks beta-1 receptors in the heart, slowing down the heart rate and lowering blood pressure. Watch out for bradycardia, hypotension, fatigue, and dizziness. As nurses, monitor those vital signs before administering metoprolol. If the heart rate dips below 60 beats per minute, hold the medication. And remember, no stopping this party abruptly. Sudden withdrawal can lead to rebound hypertension. Next up is lisinopril, our ACE inhibitor extraordinaire. It's used for hypertension, heart failure, and post-heart attack. Lisinopril blocks the conversion of angiotensin 1 to angiotensin 2, reducing high blood pressure. Side effects include dry cough, hyperkalemia, and angioedema. Monitor potassium levels and kidney function. Teach patients to call 911 if they experience swelling of the lips or tongue. Let's talk about furosemide, our loop diuretic superstar. It's used for heart failure, pulmonary edema, and hypertension. Furosemide tells the kidneys to reduce sodium and water reabsorption. It can also flush out important electrolytes like potassium, leading to hypokalemia. Encourage patients to eat potassium-rich foods. Giving IV furosemide too quickly can cause ototoxicity. Slow and steady wins the race with this one. Now let's give it up for warfarin, our anticoagulant champion. It prevents blood clots that can lead to deep vein thrombosis, pulmonary embolism, and stroke. Warfarin inhibits vitamin K-dependent clotting factors. Bleeding is a major side effect, so be vigilant. Monitor INR levels, aiming for 2 to 3 for most conditions. Vitamin K is the antidote if things get too anticoagulated. Discuss diet with patients. Too much vitamin K can throw off INR balance. Leafy greens are packed with vitamin K. Let's hear it for digoxin, our cardiac glycoside hero. It's used for heart failure and atrial fibrillation. Digoxin increases the heart's contracting power and slows down the heart rate. Watch out for digoxin toxicity and bradycardia. Check the apical pulse for a full minute before administering. Low potassium levels can increase the risk of digoxin toxicity. All right, let's give a big round of applause to insulin, our anti-diabetic rock star. It helps manage blood sugar levels in type 1 and type 2 diabetes. Insulin unlocks the door to let glucose into the cells. It can cause hypoglycemia, so always check blood glucose levels before administering. Each type of insulin has its own personality. Rapid-acting insulin needs to be given with meals, while long-acting insulin has no peak and can't be mixed with other insulins. Albuterol, the breath of fresh air. Albuterol is our bronchodilator hero, helping with asthma or COPD. It relaxes bronchial smooth muscles, opening up airways. Albuterol can cause tachycardia and palpitations. Assess lung sounds and oxygenation before and after use. Use albuterol before inhaling corticosteroids to warm up the airways. Now let's talk about morphine, our opioid analgesic superstar. It relieves moderate to severe pain, including chest pain from a heart attack. Morphine binds to opioid receptors, muting pain signals. It can slow down breathing, leading to respiratory depression. Monitor respiratory rate and use naloxone for overdose. Let's hear it for prednisone, our corticosteroid champion. It helps with inflammatory conditions like asthma, arthritis, and autoimmune diseases. Prednisone suppresses the immune response and inflammation. Side effects include hyperglycemia, osteoporosis, and increased infection risk. Don't stop prednisone abruptly, taper doses down slowly. Be extra careful to avoid adrenal crisis. Let's give a round of applause to heparin, our anticoagulant superhero. It prevents and treats blood clots. Heparin inactivates thrombin, cutting the power to the blood clot factory. Bleeding is a major side effect, so be on high alert. Monitor APTT levels, aiming for 1.5 to 2 times the baseline. Protamine sulfate is the antidote if things get too anticoagulated. And there you have it. Future nurses, 10 must-know medications for the NCLEX. Pharmacology doesn't have to be a code blue for your sanity. Approach it like a detective. Break down medications by class, understand their mechanisms, and know those nursing considerations. Group medications by class to make studying easier. Always check vital signs before giving cardiac medications. Know the antidotes for high-risk medications. Download your free NCLEX study guide at nursecareerblueprint.com. Hit that subscribe button and share this video with your fellow nursing students. Let's conquer NCLEX pharmacology together.